This video gives a thorough overview of how to use the K3 knee brace. We'll cover how to put it on, how to set it, how to take it off, and more. We recommend you watch the video all the way through at least one time before attempting to put the brace on a patient. The K3 brace is intended to be worn when resting to help gain knee extension range, but can also be used for standing and other physical therapy applications. It is not intended for ambulation. Let's take a look at how the K3 knee hinge works. The hinge has two positions. The first is unlocked, which allows for free knee flexion. The second engages the ratcheting mechanism, which lets you incrementally move to a fully extended position. Once you're at the full extension, it fights any knee flexion. It can then be unlocked and go back to free flexing to put the brace on or to take it off. Here's something to watch out for. Sometimes when your lock is engaged and your knee is extended, the tension from bending the leg can make it seem like your hinge is jammed up or stuck. If this occurs, don't worry. Simply add gentle downward pressure to the knee and your hinge will unlock. If you've ordered your K3 in a pair, the easiest way to tell the difference between the right and left is the metal upright. The metal hinge on the side is what determines the difference between the right and left. The metal always goes on the outside. In this case, we have a left brace that will go on the left leg. We see the metal on the outside here. Let's start off by opening all the Velcro straps so it's easy to put the leg in. After you've undone the Velcro, you can rotate the straps to keep them out of your way. Unlock the metal hinge with your thumb. This will allow the brace to flex so it's easier to put on. Always use your thumb when unlocking the metal hinge to prevent fingers from getting pinched. With your brace fully flexed and your leg fully flexed, you're ready to put the leg in the brace. Once the leg's in the brace, align the knee center of your joints with the knee center of the leg. The straps come with extra length to accommodate different sizes. Make sure that the scratchy side doesn't interfere with the soft liner. Make sure that the soft side completely covers the scratchy side so it doesn't stick to bedding or to pajamas. Give yourself a little tab on the end to make it easy to take off. Let's start with the knee strap first. Put the pad directly against the patient's knee. Pull the outside strap against it snug, and then the last strap will sandwich all the straps together. It's critical for the knee pad and strap to fit snugly to hold the leg in full extension. Then move to the lower thigh strap. Make sure that it's on there snug. Let's do the top thigh strap. And we'll do the lower calf strap last. Once all the straps are closed and the legs settle in, check any straps that may need further adjustment. All the straps need to fit snugly so you can reach extension. Now engage the metal lock with your thumb to make sure that no fingers get pinched. Once the lock's re-engaged, we want to slowly start to extend the leg. We want to be careful that we go slow, that we don't cause pain or discomfort. Stop once the leg has reached a comfortable angle of extension. Wait 15 minutes and attempt to stretch one more click of the hinge. Again, make sure that you don't cause any pain or discomfort. To take off the K3 brace, first unlock the metal hinge with your thumb, making sure to keep all fingers clear so they don't get pinched. Now slowly flex the leg, ensuring that you don't cause any pain or discomfort. Now you can undo all the Velcro straps. Remember to move them out of your way so it's easy to take the brace off. Now remove the leg from the brace. For new patients, only wear the brace for 1 to 2 hours at a time. This will allow you to check the skin for irritation or redness. Over the next 2 to 3 weeks, gradually increase the wear time by adding 1 more hour each day. The break-in schedule may vary depending on the child's level of involvement or past experience with similar braces. Some skin redness, especially under compressed areas, is common during the break-in period. These red spots should go away within 20 minutes of removing the brace. Stop wearing the brace if red marks persist longer than 20 minutes after removing the brace. These and other complaints of discomfort may indicate the brace needs to be adjusted, especially if issues arise after the child has been wearing the brace comfortably for a while. Contact your physical therapist or orthotist right away anytime comfort issues arise. To clean the brace, use a sponge, mild soap, and warm water. Dry off any excess water with a towel, then allow them to air dry for several hours. Do not use heat to dry braces. Over time, your braces will show signs of wear. If your brace is still effective but getting worn out, arrange a follow-up visit with the clinician who ordered the brace. Sometimes the clinician can replace worn-out straps or old padding or make other adjustments to extend the life of the brace.